Hello, dear students and esteemed learners. Welcome to my course on Sociology of Health. This is lecture number 39, and in this lecture, we'll talk about National Health Policy 2017, the context, aim, goals, and objectives. Now, previously, we have talked about the two important national health policies, the policy of 1983 and 2002. So this is the most recent health policy, and as of now, this is ongoing. And let me share with you that this policy is a very comprehensive. You can say there are so many provisions, and this is different from the previous policies in few respects. One thing that I have seen is this that this policy is talking a lot about health administration, and then it also talks about regulation. So that is a reflection of the kind of shift which has taken place at the level of the health policies. In the previous policies, we have been seeing that there is a special mention of the budgetary allocation, then the federal part, that which parts could be taken care of, the which parts could be taken care of by the center and which part will be taken care of the state or the local governments, etc. Those provisions were there. But this policy, very comprehensively and in a way, you can say that a little complex also, it talks about so many new things. And that is a reflection of the kind of changes which are taking place in the domain of health. Now, the arena of health, the domain of health is actually becoming complex. Now, there are multiple players, and we are having multiple programs, multiple requirements at the level of regulation. So, we talked about the increasing privatization in the domain of health, and something which we can witness in other policies also, other domains also, because after 1990s, India has moved in the direction of privatization and globalization. So, because of this increasing impact of globalization and privatization, the the issues related to this policy formulation have become complex, and this policy document is successful in addressing most of these issues, right? But these things make the policy very compact kind of document. So we need to understand. Now, I would like to suggest here to the undergraduate or postgraduate level students that they need to understand the major shift and the important points. But I have included almost all the points here, and this is primarily meant for people who are interested in knowing the detailed provisions of one specific area. But for a student at undergraduate or postgraduate level, those details may not be required, at least from the semester point of view. But if you are interested in knowing about those things, then you can understand those things at length also, because I have included the information in the slides. I'll talk about that, of course, precisely, because time will not allow me to discuss those things at length. So, with this kind of understanding, we are moving to the policy document and the provision that I have included. And yes, this topic we will cover in two lectures. This is lecture 39, and we will also talk about this policy in next lecture, that is lecture 40. So the policy document identifies four major ways in which the context of the present policy has changed since the last health policy was adopted, and these change contexts are basically at the beginning itself. The document says that the context has changed. the situations have changed. And yes, we were talking about those things because now we are in the age of LPG, and then there are several other things happening. So policy recognizes, acknowledges that, and it says that there are four major ways in which the context is different, and this policy is basically addressing to those things. So what are those important things? First, the health priorities are changing. There is growing burden on account of the non-communicable disease and some infectious disease. See, uh, there is a term which is known as the epidemiological transition, right? And at one point of time in any country, there is a dominance of communicable disease, and when the society basically develops, then the communicable diseases are actually controlled because those are preventable, right? So when the communicable diseases are controlled, then the proportion of the non-communicable disease basically increases, right? So the if the communicable disease are prevailing more, that means the society has not reached to the level of development where those diseases could be controlled. So this is a new pattern that in India the communicable disease have reduced and the non-communicable disease is basically appearing to be having more burden because the communicable will be preventable. Although, as of now, because of the COVID, the situation has changed, but the policy came into existence in 2017. So, at that point of time, that was a very welcome kind of situation. Then there is another important thing which is related to emergence of a robust healthcare industry. Now, the policy recognizes that there is an industry which is basically taking care of the healthcare needs, and that has grown well. That is basically the private sector. So, by the time the private sector healthcare providers have grown, right, and they have taken a robust shape, and the policy increasingly takes support and develops partnership with this. So you can look at this policy document in terms of having a kind of partnership with the private sector also. So it is not talking only about the measures that the government will take in providing healthcare to people, but it primarily talks about the kind of arrangements or management or provisionings that basically it will develop so that all important players can find appropriate role. Then third important thing is related to the catastrophic expenditure due to health care costs. The policy is recognizing that there is a catastrophic expenditure. That means the out of pocket expenditure is very high. And because of that high cost of care or expenditure, there is a catastrophic impact, and that is basically causing impoverishment. People are becoming poor because of the high cost of care. So, this is a major concern. So this is getting recognized at that level. And then the rising economic growth enables enhanced fiscal capacity. So it talks about the larger society, basically the country, that there is a rising economic growth in the country, and there will be things related to that. So new health policy is responsive to these contextual changes. However, one important thing that I would like to mention here is this, that whatever basically points I have taken from the policy document, and I have given the link of the policy which is available in the website of the Ministry of Health and Family Welfare. So anybody interested can go and check the policy, and I would recommend, if you have some time, spare time, then do go through that policy document, right? It will give you further insight. So what there are primary aims identified in this policy document, right? So there are goals, objectives, as well as primary aim, right? Some of very often these terms are basically appearing as synonymous, but in this policy document, the policy has used all these terms separately. So what is this primary aim? The primary aim of the national health policy is to inform, clarify, strengthen, and prioritize the role of the government in shaping health systems in all its dimensions. So very categorically it is mentioned that the government is basically taking care of the role of basically regulating the things, because it talks about shaping health systems. So it's not talking about only the one specific kind of system, it talks about the different types of system, right, which are operating at the national level. And we will see that it talks about the existence of multiple systems, and then in this context it talks about to inform, clarify, strengthen and prioritize the role of the government, right? So the details are also given here, and these are actually very helpful in having a further insight. So, what are the possible dimensions in which the government will work or operate? The dimensions are investments in health, then organization of healthcare services, then prevention of disease and promotion of good health, then access to technology, developing human resources, encouraging medical pluralism, building knowledge base, developing better financial protection strategy, and then strengthening regulation and health assurance. So, this strengthening regulation and health assurance is basically very important. It talks about the regulation and the need of strengthening that. And then, very interestingly, it also talks about health assurance. So please notice that it's not the insurance. Insurance is also there in this policy, but going beyond that, it talks about assurance. However, the application of the word health assurance will vary from program to program, and the details of those basically will depend upon the specific program. Now, one important thing which I can see at this level is the prevention of disease and promotion of good health through cross-sectoral actions. This inclusion of cross-sectoral actions is a very important, because you may remember when we were talking about the public health topic, then we were saying that there are basically a kind of interrelatedness among the various sectors or the ministries, because when we are talking about health, then we need to talk about safe drinking water or food or nutrition, or for that matter infrastructure facilities or the roads also, right? And then wastewater disposal, so many things basically. So this policy recognizes that when we are talking about health, then there is a need to look at the things from the cross-sectoral perspective, and so there is a specific provisioning related to that. We will see that in the forthcoming slides also. Then the goal of National Health Policy 2017. The policy envisages as its goal the attainment of the highest possible level of health and well-being for all at all ages. So simply the goal is basically achieving health and well-being for all, but at the same time it also adds at all ages. That means it includes from the birth or from the state of the fetus to the time before death, that means the elderly age also. Now that is important because the population which is basically coming under the elderly group is increasing, and most of the developed countries that is emerging problem, or you can say an emerging concern, not problem but a concern. So although here it is not mentioned that we are talking about the elderly, at least at this level, but at all ages is basically suggesting you certain things. Indicative it is. Through a preventive and promotive healthcare orientation in all development policies. Now, this is the intersectoral approach in all development policies, because education is a development policy, right? That means if you're talking about education, then within the system of education, there would be certain things which could help which could be very helpful in improving the health behavior of the people. So the ministry which is taking care of the health issues is not supposed to provide the education, right? So the education related to health, or for that matter any other things which can be helpful in improving the quality of life, that can be provided by the education sector. Or for that matter, if drinking water we are talking about, then we should not expect that the health sector should go and provide safe drinking water. That safe drinking water will be taken care of by a different ministry, right? But when we look at the things from the public health perspective, then we identify that these are basically interrelated things, and we need to take care of all these things, because for managing the communicable disease you need to focus on the sanitation and the environment. And there are so many social determinants. We have been talking about good number of social determinants. So not all those factors or determinants could be taken care of by one single agency, and that is why basically it is talking about in all developmental policies. This is very important. And universal access to good quality healthcare services without anyone having to face financial hardship as a consequence. Now, at this level, it also mentions that there should be a kind of affordability and no one should have the financial hardship. So, what kind of module it is suggesting? We will come to that when we will move forward. This would be achieved through increasing access, improving quality, and lowering the cost of healthcare delivery. Now, you need to decode the meaning of the word lowering the cost of healthcare delivery, because healthcare delivery is having a cost, right? Now, it is not talking about the government sector or the private sector. So, basically, the healthcare is going to have a cost, but the government will take care that it should not be very high. That means there should be some mechanism by which it can it can keep the cost lower, right? So the policy recognizes the pivotal importance of sustainable development goals. Yes, we understand that the sustainable development goals basically came in 2015, and they are basically going to cover the time period from 15 to 30. So this national health policy came in 2017, right? That means as the previous policies were basically reflecting some of the global vision. So just like that, this policy is also at some level reflecting the goals which were adopted in the sustainable development goals, and we have already seen the sustainable development goals. So good number of basically goals there are related to health, right? So there is a reflection of that, and the policy acknowledges that. Then the key principles. Basically, this policy has identified the 10 key principles, and needless to say that every policy is having certain principles, but we need to understand those principles also, because sometimes those principles do suggest a direction, right? So these are the principles: professionalism, integrity and ethics, then equity, affordability, then universality, patient-centered and quality of care, then accountability, inclusive partnerships, pluralism, decentralization, dynamism, and adaptiveness. Now, I have highlighted three principles here: affordability, inclusive partnership, and dynamism and adaptiveness. So, why did I highlight these three? Because these are actually, again, indicative. Indicative in the sense that when you are talking about affordability, that means you are saying that there will be a cost, and the government will basically try to keep that cost at minimum so that it should remain affordable. But affordable means that a price has to be paid, right? So that can be one interpretation related to that. And then inclusive partnership. So the government is talking about partnership. That means we are going to have a kind of system or mechanism in which the government players will be there, but at the same time there will be the private players, right? So and then a third category, basically the not-for-profit NGO category will also be there, and the policy says that there will be an inclusive kind of partnership. That means the government will take help from, support from, and a kind of inclusive partnership with the corporate sector, the private sector. So this is also one step forward towards a kind of dependence and a kind of support from the private sector that we generally talk about when we say privatization. And then dynamism and adaptiveness. So again, this dynamism is talking about a kind of not having a rigid kind of thing. That means if required, it can take support from other agencies. And then adaptiveness, because it can adapt to those new situations if required. Then we come to the objectives. I have tried to include all these objectives which are mentioned here, but technically it will not be possible to explain all these, but the important ones I have highlighted, right? So we will talk about that. One very important thing basically that I have highlighted in red color also, that we will try to understand, because this is something new that you might not have heard before if you have not read this policy document, right? So the objective is progressively achieve universal health coverage, right? So what is this universal health coverage? Primarily, the World Health Organization talked about universal health coverage, and the global agencies are talking about because when the cost of healthcare is increasing and the out-of-pocket expenditure is increasing, then that creates a catastrophic impact. That means that creates a negative impact, right? So very often that causes impoverishment. So that basically goes against the will of the government and of the global agencies also, because that kills the entire purpose of development, right? So people should not go back to their below poverty status, or people should not uh, have to face the impoverishment kind of thing because of the high cost of care. So there should be some mechanism by which the burden of the high cost of care could be addressed, and for that the global agencies basically recommended the universal health coverage mechanism, and India has also adopted a model to include this universal health coverage uh, mechanism, right? So the objective is here that progressively achieve universal health coverage, right? Progressively is also basically indicating that we are not going to achieve the entire goal in one policy or within a very short period of time. It will take time, but progressively we will achieve that. So point number A, assuring availability of free comprehensive primary health care service, right? So the primary health care service will be free of cost, right? But it's talking about primary health care services, right? It's not mentioning here the secondary or the tertiary. So the primary health care is going to be free for all aspects of reproductive, maternal, child and adolescent health, and for the most prevalent communicable, non-communicable and occupational disease. So the diseases which are basically most frequently uh, faced by people, those will be available under the primary health care, and that will be free. The policy also envisages optimum use of existing manpower and infrastructure as available in the health sector, and advocates collaboration with the non-government sector on pro bono basis for delivery of healthcare services linked to a health card. So the term pro bono basis is highlighted, and it's important. So I have mentioned the meaning of the word pro bono. This basically talks about for the public good. The term generally refers to services that are rendered by a professional for free or at a lower cost. So when we are talking about pro bono, that means we will hire the services which could be available either free of cost or at a lower cost. So when you are going to hire the services, but certainly it is not going to be free of cost, that means you will opt for the services which are available at a lower cost. That means you are talking about hiring the services at a cost, right? So now the context is this: the collaboration with the non-government sector, right? So the government sector will develop some kind of collaboration with the non-government sector, and if the services are available free of cost, then that is good enough. But if those are not available free of cost, which is going to happen most likely, then a kind of purchasing these services will take place, but preference will be given to these services which are available at a lower cost, right? So that kind of arrangement basically will be achieved for achieving the goal of universal health coverage. Then ensuring improved access and affordability of quality secondary and tertiary care services through a combination of public hospital and well-measured strategic purchasing of services in healthcare deficit areas from private care providers. Now, very straightforward, it is saying that there will be a purchase of services when you are talking about the secondary and tertiary level care, and it also says that this purchase will take place from the private sector, from the private care provider, especially the not-for-profit provider. So, depending upon the availability of the not-for-profit providers, the kind of services will be purchased. Then, achieving a significant reduction in out-of-pocket expenditure due to healthcare costs and achieving a reduction in proportion of household experiencing catastrophic health expenditure. So, basically, it targets to achieve the reduction in the out-of-pocket expenditure. But the government is not making a claim that it will increase the government expenditure to a big proportion. Now, that is not there. Then it talks about reinforcing the trust in public healthcare system. That is very important, because if the trust is re-established in public healthcare system, then people make use of that. Then align the growth of private healthcare sector with the public health goals. Some kind of alignment so that the private and the public can go simultaneously, right? And then there are specific quantitative goals and objectives. So the goals and objectives have been mentioned before, but for the convenience of execution and implementation, there are actually quantitative expression of those goals and objectives. So there are a good number of provisions which talk about these quantitative expressions basically, right? The indicative quantitative goals and objectives are outlined under three broad components. So all those goals and objectives are basically coming under three categories: health status and program impact, then health systems performance, and health system strengthening. So there are three core areas. One is related to the health status and program impact, so that is quantified. Then system performance, that has also been quantified in terms of objective, and then system strengthening, that is also there. So in the forthcoming slides, basically we will see the previously mentioned goals and objectives, but in terms of more quantitative basically goals and objectives, like life expectancy and healthy life. So it should be increased from 67.5 to 70. Then disability adjusted life years should basically taken care of. Then a reduction in total fertility rate should be taken care of. Then it talks about the mortality by age or cause, and categorically talks about reduce the neonatal mortality to 16 and stillbirth rate to single digit by 2025. So just like that, a good number of goals and objectives are mentioned. There are good number of specific quantitative goals and objectives related to the disease prevalence and incidence. You can have a look on the specific provisions for HIV/AIDS, then certain diseases like leprosy, Kala-Azar, and filariasis, then blindness, cardiovascular disease, cancer, diabetic, etc. And then health system performance. For this also a quantitative goal is given, that increase utilization of public health facility by 50% from current levels by 2025. And then cross-sectoral goals, basically which talks about having increasing intersectoral coordination and support, right? Example, if you want to make provision for safe water and sanitation, then you can take support from the related ministry or the department, right? So just like that, a cross-sectoral coordination is required. And then health system strengthening is very important, and for this basically health finance and health infrastructure and human resources, all these things are basically identified. And then health management information is also included, because there are so many sectors which need an appropriate administration and management. So these points have been identified, right? So this is how we look at some of the important issues which have been covered in the National Health Policy 2017. And there are other issues that we will take care of in the next lecture. So till then, take care and have a look on the think about this and activity question also. And we'll meet in the next lecture.